This, of course, requires both provider adoption and consumer access to information and tools. The access is often thought to be something more outside the scope of what's currently going on than is actually the case, because the statistics of consumers that have cell phones and increasingly smartphones are just incredibly high, and we need to increasingly see these as health IT, not just electronic health record systems. So better outcomes, of course, are going to be achieved by consumers and providers who use this information collaboratively rather than independently, and this leads to the chief concept for us that better use of information is foundational to achieving the goals of reform. We've talked a little bit this morning about the difference between having health IT and using health IT, and we want to have the use of information be increasingly emphasized. So the system we envision focuses on the health and well-being of individuals, and it uses knowledge that comes from these individuals to improve care for populations and the nation overall. And the characteristics of this information-rich healthcare system include clinical and personal information being used to provide holistic care, communication of information being used to meet health needs regardless of physical location. So that needs to be communication that reaches individuals both in urban areas, rural areas, sophisticated, and those consumers that might not have the access that others do. The right information, that accurate information, has to be transmitted to and from the right person at the right time to improve both safety and quality. And information has to be accessible in real time to improve accessibility, efficiency, and affordability of care. Other characteristics of this information-rich healthcare system that we envision includes that information be presented and used in meaningful ways. And we talk sometimes about a blue button capability, and we should be talking increasingly about a download capability for health information. But sometimes you see, or I have seen demonstrations of what it looks like sometimes when you download this information, and a healthcare record can be incomprehensible. And so we need to find ways to present information in both a visually compelling and an actual meaningful, usable way. Information, of course, has to be exchanged in a way that is both private and secure, and that occurs without unnecessary barriers. And information has to be used to ensure fair and equitable treatment of all people. We focus and want to increasingly focus on information use as a way to reduce disparities. So, of course, the whole point of this is that consumers must play a role in this healthcare system. We want consumers to be active participants and partners in this health system vision, and as active participants, we will help ensure the success of our collective efforts through several ways. One, acting as agents of change. It's one thing to complain about the healthcare system and identify all of the ways in which it's failing us, but we have to be participants in redesigning it. This includes policy and implementation engagement by consumers and consumer advocacy organizations, engaging in health policy making and governments more broadly at the federal, state, and local levels. It also means taking responsibility for educating ourselves about our health care and health needs, conversing with our healthcare providers about our priorities, speaking up when we have questions or concerns, and returning feedback to our providers about our care experiences. We want consumers to participate in shared decision-making. Obviously, the volume of health information is exploding, and information is being added to the mix via new media such as wikis, blogs, and online communities. But we want, in addition to this, patients to see themselves as experts on what matters to them personally. Some patients will choose one treatment versus another, even though they have the same condition. And so we want patients and consumers to work more closely and in collaboration with providers to determine the best course of treatment from both the clinical and the individual perspective. We see consumers as being an important way of verifying facts and providing context. Right now, facts about an individual's health and care reside in a number of different places, and it's the consumers often that are the experts on what information is true and should be taking increased initiative to correcting errors and providing context. And consumers can play also, and we hope that they will increasingly, a role in integrating better healthcare into the full context of our lives. We are hoping that healthcare stops being just seen in the context of a provider office or hospital and starts being seen more broadly in the full context of a life. Obviously, personal health records and other social media and smartphone tools are important resources for engaging consumers on an ongoing daily basis in their care, which will maximize their health and the outcomes of any clinical interventions they receive. So if we're successful in all of this, and I hope that they will be, I don't think that changed. We will be successful in maximizing the health and the well-being of the individual, improving health care and health outcomes for populations, providing a real return on investment for taxpayers. It's important that we remember that programs like Meaningful Use are funded by the taxpayers, and so the taxpayers being patients, need to see real and meaningful outcomes. Transformation and sustainability of the healthcare system, a decrease in the burden of illness so that it falls not just to the patient or the caregiver, but is shared more broadly. That healthcare dollars are used more effectively and efficiently. And on a sort of smaller basis, health being integrated into our daily lives every day and in many ways. That new payment and delivery system models start to reward increasingly quality and earn increased consumer trust. That we can decrease and eventually eliminate healthcare disparities. That caregivers have the information and tools they need to fulfill the roles that they play in each individual's care more effectively. And more broadly, that as more people engage, social norms and expectations will shift and others will follow. And that's really a huge point here, is that increasingly we're talking about healthcare in a patient-centered way. And the goal of my presentation is to help us see consumers as participants, partners, and participants and partners in this. And that if we can change that shift and start to see patient-centered care in a more meaningful way, and as seeing consumers as participants rather than just sort of the objects of delivery, that this will bring about a full and comprehensive transformation. Thank you. I'm happy to take questions, I assume, at the end of all of this, and here's my email address if you have them offline.
Yeah, Alice, thank you, and we will hold the questions till all three presenters have had the opportunity. Will, hopefully it's your turn now.
Very good. Is that a clicker? Welcome, everyone. It's a pleasure to be here. Thank you, Simon, for the introduction. My name is Will Yu from the Office of the National Coordinator for Health IT, and I have the privilege of helping the agency scan emerging technologies and really put on the radar for the leadership within the organization. What are the technologies that are emerging within the space, and what are the technological trends that we need to be paying attention to? I'm joining you here today really to not as sharing my policy perspective or what we're doing as within the office with regards to meaningful use, but really sharing some observations with regards to what I've been seeing in the space with regards to consumer-facing technologies, and really summarizing some of the findings that we had from a recent personal health record panel discussing, among other things, privacy and security issues, but also what are the emerging trends that are taking place within the consumer space. On a personal note, I would really characterize the degree of innovation that's taking place within the environment as extremely high. When I attend conferences, when I speak to those who are actively developing applications, those who seek to adopt and really launching new initiatives focused on the consumer or the patient, there's a palpable enthusiasm, okay? And I think that we would be remiss to not dive deep into the specific issues of what is driving innovation today, what are the implications, and how might that tie into what is our future worldview of what is health IT. I think, as Alice very astutely pointed out, the environment is rapidly changing, and we need to be cognizant of what is driving those changes. And so it's my job, along with a core group of very dedicated individuals within the Office of the National Coordinator, to I guess take up that charge. We're privileged to have Lygia join us in the coming weeks and months, and hopefully she will add significantly to the small band of folks who are are currently focused on these issues. By and large, the Office of the National Coordinator has been, I guess, on the public side, really focused on meaningful use and our current programmatic mission. But underlying all of it, I would say there's I guess a distinct focus on the patient, the consumer, and really trying to understand how we can really engage them, how we can continue the dialogue, and really bring them into, I guess, our policy making and decision making. So let me share with you some of the high-level points that I'll be talking about today. Okay, so really, there's a growing comfort we're seeing within the space with consumer health data, leading from a passive effort that's been, I guess, that's been permeated the space over the last few years to more of a participatory nature. Okay, and this is not really just consumers and patients, but really all stakeholders within the healthcare spectrum. Technology as a mitigating factor to navigating health services challenges, as we begin to see specific uses of technology intermediate themselves within to address challenges associated with data transfer and delivery care, whether that be clinical data, administrative data, or population-level aggregated data, which I'll be talking about in a little bit. Okay, really technological trends drawing interest on the supply side, or where I put the innovators and those who might develop applications, and the demand side from really the patients, the consumers, those who have seen a algae bloom of data in other parts of their lives, but really are found wanting on the healthcare side. And really what this is leading to is a way of addressing the long-term challenges with consumer-facing technologies, which are the engagement and the behavioral changes issues, which is really kind of what we're all working towards. The difficulties that we've seen in the space previously have always been trying to sustain a high level of engagement between the patient or the consumer with the technology and leading eventually to a behavioral change, and we're slowly seeing efforts towards that end. Okay, as I go through these slides and I begin making my points, please keep in mind that I'm not just speaking about the patients and the consumers and the caregivers. There's a whole host of other stakeholders involved in this process, and they each will have interpretation, a flavor to how they begin to innovate and develop. When we start throwing pharmaceutical companies, pharmacies, payers, employers into the mix, how will they interpret the opportunity that new data presents to them? How will they take advantage of the situation, and what implications does that have for policy? So I'd urge you to keep that in the back of your mind as you begin to noodle over some of these points and pick over some of the observations I'm seeing, and I'd welcome your questions towards the end. So what we're seeing really is a growing familiarity with health technology. According to Pew Internet and the American Life Project, a resource I encourage all of you to draw from, we're seeing a higher percentage of internet users, adults who have looked online for information about a specific disease or disease category, from the low 30% range, not 5 years ago, to almost half of the population now. And that is a trend that we're seeing steadily throughout all of the metrics that are currently being researched with regards to how consumers are really interfacing with technology.